Alright, you're back for infection control. Oops, sorry. I think we're on patient care number 8. So reviewing your infection control terms. So medical asepsis versus surgical asepsis. Which one is the complete removal of organism and spores? That's the surgical asepsis. Sterile technique would be gloving, masking, assisting with sterile trays, preparing syringes. Equipment disinfection, we need chemical asepsis. If using bleach, it has to be a 1:10 ratio with water. The equipment sterilization is going to be heat, gas, or chemical asepsis. Alcohol is not a disinfectant, so if you have those alcohol-based wipes. Pathogens, terms to know, so microorganisms that are capable of producing disease, fomite, cassette, object or material, if you use image receptor or IR instead of cassette. I always called it film, and now it's no longer a film, but I remembered fomite and film. A vector, V for vector, I remember it as a vermin. It would be an insect. I see this term a lot, so it could be HAI, which is hospital-acquired infection, or nosocomial infection would be hospital-acquired. A UTI is most common. The iatrogenic infection is the result of a physician. Modes of transmission can be direct or indirect. So direct contact is touching. Indirect contact will be touching something else. So fomite could be hands, your x-ray sponge, your cassette or your IR. I used film to remember it. Vector could be a mosquito, which vector vermin. Airborne, remember airborne is going to be your droplet, so you need eye protection. So like your TB patient, you need an N95 mask, and you also need eye protection. Okay. Neutropenic, it will either be termed neutropenic or reverse isolation or protective isolation. The neutropenic means that we are protecting the patient from us. So like your oncology patient, that has a immune system that's not as strong, and they need to be protected from us. So that would be your neutropenic precautions, which I usually see on oncology the most. Infection control. So you need to know the chain of infection, and I'm a big fan of this Purpose Games website. It's free. It has a free infection control game that you can play. But knowing the order, knowing the terms, and knowing essentially an example of it is important. So go back through your patient care textbook, go back and play this Purpose Games infection control game to help you remember that. Negative pressure rooms, where would you see it? Who would need it? They're essentially an airborne infection isolation or infectious isolation units. We use it most often probably for our TB patients. And there's usually this sort of outside room here that allows you to come in with a portable machine. So they kind of block off the normal doorway because they need to keep the room in a negative pressure. So most often you're going to see it as a TB room, something like that. And obviously you need your N95 for that room. And then CDC Standard Precautions, so aseptic technique, your hand washing. Always remember your hand washing is the most effective method of preventing the spread of infection. You need to wash your hands for about 20 seconds. Sterile procedure would be 1 minute. When gowning, passing each other, either back to back or front to front. Gloving, you have to keep your sterile gloved hands held above the waist. And your masks should cover mouth and nose snugly. Disposal of contaminated materials, you want to place them in the properly labeled containers or bags. Chemicals, never mix the chemicals. If they ask you a question about, you have a partial bottle of, say, betadine, or 2 partial bottles, can you combine the 2? No, you can never combine them into one. So everything needs to be labeled. You can't sort of pour one into another. You have to wear your PPE. Linens, watch out for soiled or contaminated linens. Those need to go in the appropriate receptacles. Sharps, containers for needles. You should never be recapping a needle, and make sure the container is puncture proof. There's a list on the content specs that has this MSDS, that stands for Material Safety Data Sheet. It's a document that provides workers with procedures for safely handling or working with a particular substance. So each of your facilities should have an MSDS, Material Safety Data Sheet. It's essentially a sheet of all the possible cleaning supplies that you have, or certain substances that need to be disposed of. In general, go with the facility's protocol for containing, handling, and disposal of infectious waste.